At Nagico, the things that matter to you matter to us. Like your boat when you're at sea and you get away from everything. Your home and the security of your daughter's things. And the car that you've had for too long, but after all these years, you just can't let go. At Nagico, we're about much more than just insurance. We're about the big things and the small things that mean everything.
St. Kitts and Nevis has moved a step closer to implementing universal health insurance. Plans for universal health coverage was unveiled at an official launch ceremony at the St. Kitts Marriott Resort on Friday, February 23rd. Professor Carl Theodore, Director of the Health and Economics Unit at the Center of Health Economics, University of the West Indies, St. Augustine campus in Trinidad, spoke at the launch on Friday. He said NHIs are a financing instrument, but the purpose is to get the health system to work better.
Is that how you finance the health system will determine how it works. It will determine what services are made available. It will determine how the services are going to be delivered. So WHO and PAHO are telling us that if you really want to get universal health coverage, you really have to finance the system in a certain way. And WHO has made it very clear the way to finance the health system for it to work well is through what we call social health insurance. National health insurance is one version of this social health insurance.
Minister responsible for the National Health Insurance, Eugene Hamilton, said that while healthcare coverage will be extended to the wider population, focus will be placed on the most vulnerable in society to ensure that they can enjoy the quality health care that everyone deserves.
Hemodialysis in this federation costs $125,000 per year. What if the private insurance decides you are a bad risk and cancels your coverage? Then what? Lack of health insurance is a real nightmare being faced by real people. Naturally, when reality hits, people turn to the government. Which government treasury can be the medical ATM for all people?
Meanwhile, Prime Minister Dr. Timothy Harris noted that the launch was a momentous occasion for the government as it works towards delivering affordable health care to all citizens and residents.
The government of today denied itself the opportunity to help our people. It is now the responsibility of Team Unity to step into the breach, and we will succeed where others before us failed to do the right thing for the right reason. For us, this is an urgent matter, and we are making steady progress on our health commitment.
As explained in an official brochure, the National Health Insurance, NHI, is a proposed national system of shared contributions and prepayment by all persons for a package of health services to meet the health needs of the population. Contributions may be shared with employers, and in some cases, government will contribute on behalf of those unable to do so. The NHI fund will be managed by a government-appointed agency. The agency will sign contracts with health service providers for the delivery of a package of benefits. As such, NHI members visiting a health service provider will only need to present a membership card, and the associated bills will be sent directly to the NHI agency for payment. Any small co-payments are made by the patients directly to the health service provider. Prime Minister Harris said the government's national health insurance will cover all persons, regardless of age, employment, income, or pre-existing conditions. Andre Huey, SKN Newsline.